Hi everyone, today's video is on adult hygiene. I'll just give you a heads up before we start. The video is about 20 minutes long. This is kind of I've done a couple of takes on this, and it's really, I can't get it really much shorter. I'm trying to cover a lot of really important topics as we go. So just grab a coffee or settle in to watch. Basically what we're going to do is provide a complete bed bath on my patient Mary. Now in lab we are going to break this way down, and we're going to talk about different types of bath, the complete versus the partial, the patient that can assist you versus the patient that can't. So we're going to talk about a lot of variations, but the video's purpose today is to complete a complete bed bath on someone who needs full assistance. So there's many things that you need to think about whenever you're going to provide the care. And we're going to start with, you have to maintain safety. The patient has to be safe because we are going to raise the bed height to a working height that's comfortable for myself, because when you go back to body mechanics and I'm going to be reaching and stretching, I don't want to put myself at risk. So the bed is going to be raised, so therefore I need to anticipate my needs. What do I need to bring to provide the care to Mary? Because once I get her up here, I don't want to be running and leaving her. So I'm going to have the side rails up, and I'm going to have her at an appropriate height for me. I've anticipated really what I'm going to need, and I'll kind of review that with you. So basically Mary, I brought her a new Johnny shirt. I have several towels. I have a few face cloths. I have a basin full of warm water, kind of halfway full. I have some blue gloves, which I'm going to need to provide the care. I have, and look, there's 100 versions of this, but this is a pH balanced soap. So it's not like that bar of ivory that gets the water really, really gross. It's pH balanced. It's a no rinse formula. We use it in a lot of institutions now. It's really kind on people's skin. So just watch. Some people might bring their bar of Dove from home and that's what they prefer. That's fine. But just know that there are different options. So this providing care is no different than you providing care to yourself. You have likes and preferences for products, and the patient really would be no different. In a lot of institutions it has to be unscented, so just there's a few little things that you need to pay attention to. So I'm going to use a pH balanced soap, and I've also brought some lotion. Mary's teeth, she has dentures and they're in the cup, and I do have a comb and a toothbrush and different items, and I'll get to that whenever I get to the mouth care. So I'm going to kind of walk my way through. One thing to remember is you're going to see many versions of the bed bath. If you put 10 nurses in a room, we're going to do it 10 different ways, and all are probably legitimate. So you just need to think about what's happening when and if it's appropriate. So there's lots of different ways to do this. This is your opportunity with your patient to do a full head to toe assessment. You guys are in health assessment right now, so you're kind of working your way through the systems, so which is really beneficial. So we're going to do a full-on skin assessment, and we'll talk about that kind of as we go. But just think, I might not be saying it, but I'm actually looking at the patient's skin as I go. And we're also going to do an oral assessment. Now when I do a bed bath, I tend to leave the oral care to the end. If you look online on videos and in the book, a lot of times they start kind of at the top and they work their way down. So oral care is one of the first things that they do. So it doesn't matter where it goes, it just matters that it's done and it's done right. So I'll give you a version of the bed bath, and again, you're going to have to work it so that it works for you and your patient. When you are in different facilities and seeing different versions of the bath, what I do want you to be aware of is people can provide a really good bath quickly. This is going to take me 20 minutes to go through because I'm talking my way through, but just know that there's many versions. Look and see what people are doing. Take the good, leave the bad, decide if it follows the principles. This is kind of where you need to decide on, you're the nurse and what care are you going to provide, because you can only really control you. So on that note, let's start the care. So I already previously put Mary up to a safe height. Her bed rail is up. I am going to provide the complete bed bath, but I am the only nurse here. Therefore, I brought my supplies and the table, and it's on my side of the bed so that it's closer for me to work. If there was 2 nurses here, I could take this table and kind of bring it up the end of the bed so that it kind of comes up over the feet, so that I could reach, as well as the nurse on the other side. We could both reach the water, and we would both do one side of the body. To keep the video as short as I can, I'm going to only wash one side of the body, and you can obviously make that extension that we would be doing the whole body. So I'm going to use Mary's bed sheets because I want to maintain safety. I want to maintain privacy. I want to have warmth. I want her to be warm. I don't want to just strip her off and have her here feeling vulnerable. I want to promote independence. If she's able to do any of it, I'm going to get her to do that. She can wash her own face. She can wash her hands if applicable to your client. For this, Mary, I'm going to do it all. Okay, so I have my set of gloves. I have my warm water. I did bring, in the book it talks about a bath blanket, but I did bring a blanket. It's at the bottom of my bed, and it's there if I need it. These are Mary's bed sheets that she's currently sleeping in, and I am going to replace those and do a complete bed change after. And we can incorporate that all together. It gets kind of tangled up, so I'm going to leave that out for now. This is just about the bath. So I'm going to pull down the bed sheets here just so that I can kind of see what I'm working with. And I'm going to take a couple of my face cloths and put them in the warm water and a couple squirts of the pH balanced soap to get me started. Okay, nice warm, fresh soapy water. Again, patients may or may not want soap in their face, so you may have to figure that out before you add the pH balanced soap, but it is very mild. In the book it talks a lot about, or it shows you to go around your hand and tuck it up and do all that, you know, so that it's a nice neat little packet. It doesn't matter to me if you do that. The thing we don't want to see is that the cloth is being drug over the patient. So I just kind of scoop it all up into my hand, sort of like that. I'm going to start with the eyes, and I'm going to work at the inner canthus out, and then a different spot of the cloth for the other canthus, inner canthus, and move my way out. So we'll start here. Inner canthus out, different part of the cloth, inner canthus out. Okay, Mary doesn't have any discharge in her eyes, so the cloth is still clean. And now I'm going to wash her face. Okay, so again, being aware of the patient's sensitivities, and in the institutions the cloths aren't always downy soft, so just be cautious of how hard you are rubbing. I might be a little more aggressive because it's a mannequin. Okay, so the face, I've got that part done. Her lips, I want to make sure that, you know, if there's dry skin, get that. I need to check behind both ears. So I got to get behind this head. I'll get her to turn. I can check behind both ears. She's going to turn this way, and I'm going to check behind. I'm going to get her neck, and that all part looks good. Cloth still clean. It can go back in the water. I'll take my towel, and again, one part inner canthus out, another part inner canthus out, and then I'm basically going to dry her face. Okay? So her lips are good, behind her ears, behind here, and her neck. Every joint we can be providing range of motion. So when Mary turns her head this way, and when she turns, so I can check behind the ears, and she turns it this way, that is some range of motion. She may lift her head up so I can see underneath. So just remember, if it's applicable to your patient, this is the time to do range of motion. People that are up and walking around, they don't need range of motion, but Mary's bedridden and she's in bed, so I might want to perform some range of motion exercises on her. So just keep that in the back of your mind. Okay, so I'm going to come here now to do her hands, or her arms and hands and under her arms, and I'm going to keep her covered. Okay, and I'm going to take my towel and I'm going to put it underneath the arm. Okay, I'm going to lift her arm up, set it on the towel, and I'm going to come back. My water is still warm, my cloths are clean. Wring it out, and I'm going to go distal to proximal. So I'm going to start distal, move proximal, nice long strokes. It helps promote circulation. And the thing about it is, when you know yourself, if you're being bathed, you want to know that you were bathed, so you want to provide really good care. So I want to get in between the fingers, and at this point you're checking the fingernails. You might be doing cap refill. You're checking the palms, the elbows. You need to lift up and get in under. Again, range of motion here, range of motion here. So she might move her arm for her shoulder joint. So I have that option. Still clean. I'm going to use the towel, and I'm going to dry. Okay, so long strokes. Dry her hand in between her fingers. Lift it up. Make it dry. Okay, that's arm number one. I am going to repeat the procedure on arm number two. and I can still keep Mary covered at this point. Okay, arm number 1 is washed, arm number 2. So Mary, I'm just going to take down your shirt and I'm going to do your chest and your belly, and then I'll cover you right back up. Okay, so I'm just going to lay my towel where I know where it is. Water is still warm and soapy. Cloths are still clean. I'm going to get everything that I see. So shoulders, chest, breast, lift the breast to get in under to see if there's any excoriated skin underneath. Again, over here, lift, look under, clean, and belly. Now, if you didn't get the armpits when you were doing the arms, now's the time you want to get them. And I mean, give people a good cleaning. Like, I know it looks like I'm being a little more aggressive on the mannequin versus somebody's delicate skin. But at the end of the day, you want them to be clean. Still relatively clean, the cloth. I know there's skin cells on it, but it's clean-ish. Okay, so I'm going to get the chest dry. I'm getting under the pits dry. I'm lifting the breast tissue. I'm making sure it's dry. Lift on this side, sure it's dry. Belly's dry. Okay, Mary, that's the top. Now, I see that you have some deodorant here, so I'm going to use deodorant on her. This is not real complicated, people. If you bath yourself and use deodorant, chances are people do, your patients do as well. So this is 90% of this is common sense. So I'm going to provide her with her underarm deodorant and get that fixed up. It's lovely. And now I'm going to apply the clean shirt. Okay, so I really have kept her fairly as covered as I can up to this point. So I think this is so far so good. Okay, Mary. Now I'm just going to get that towel out from underneath you. Still good, and that is still good. Okay. So this I'm going to take out because this is the old one. I did bring a laundry hamper with me, so I'm just going to turf that right into the laundry hamper. You can't put dirty linen on the floor. It's an infection control issue, and you don't want to stack dirty laundry on the bed. Really, it's best if you remember to bring a hamper, okay? So at this point, I'm clean from here to here. I'm going to skip this section, and I'm going to now clean this section. And again, many variations as to how we're going to do this. So I want to keep her clean here, and I'm going to take off the bed sheets. But Mary says she has a little chill, and she's kind of cool. So I'm going to use that blanket I had, and I'm just going to put it over the top of her to kind of keep this section warm. Okay, so I'm going to move my way down. And now you don't feel as exposed if you have a bit of weight and a bit of warmth on you. I'm going to take the towel, which is still clean. I mean, it's like you can use a towel in more than one zone. Underneath one leg. So I don't know if you guys can see that as much in the video, but the towel is underneath this leg. And again, same thing. Water is still warm. Cloths are still clean. Distal to proximal. And I mean, I know I'm going down and up, but distal to proximal, right up to the groins. For the feet, try to keep this on the video here for you. For the feet, in between each toe. So you're going to go in with your face cloth, in between each toe. You're going to wash the feet. You're going to wash the bottoms. You're going to check the heels to see if there's any pressure spots here. Because anything that, I know you're all laying on the bed, but there's certain pressure points that get more pressure. Your heels are one of them. And they can have bed sores or blisters, so you need to physically lift or bend or get under there to see that those heels are okay. And again, right, range of motion when it's applicable. So I've got her washed on the top, got her washed on the bottom. Nice long strokes, skin looks good. That cloth can go back in the water because it's still clean-ish. In between the toes, heels. Okay, leg is nice and dry, but Mary's skin is very dry, so I'm going to add some cream. Okay. So when I go to chart, I can with 100% confidence say that she has no sores in her heels. And I can with 100% confidence say that her skin is in really good condition. It's dry, it's flaky. I applied cream, and I provided good care to her skin. Okay? Repeat the procedure for leg number 2. Okay, so while I'm doing a full skin assessment, right, I've checked behind everything, checked under creaks, cracks, and crevices, and I've checked her whole legs. From this point, I'm going to keep this towel, because I may or may not need it. I'm going to just cover her up, just for privacy and just for comfort. So I have cleaned all of this, except now here's where I'm at. So I have a couple of options, and we're going to beat this down more in lab. Depending on if they were incontinent, or they might be dirty here from a bowel movement, it might just be urine in the pad, they might not be wearing a pad. There's a lot of options here. So for my scenario, Mary is clean. So she's not incontinent and she's not wearing a pad. So right now, for me, I feel that the water is, I've used it enough. It doesn't feel fresh to me anymore. It's kind of cooler. So I'm going to go change the water. So before I can go, I have to raise both side rails because remember, I elevated the height of the bed. So in order to have Mary safe, I want to have all the side rails up and ensure that she is actually predictable enough to stay where she's going to be at a heightened bed level. And I'm going to get rid of this dirty water. So at this point, these cloths, I'm going to throw them out. Okay, I'm going to throw those out, and I'm going to throw that towel out. And everything's up, it's good. I'm going to go and I'm going to discard of the water, get nice warm water, and we're going to say we time work that, and I'm back with some fresh water. So I still have a couple of towels and a face cloth here, and now what's left to do is Mary's back and her perineal area. So I'm going to start with her back because that's going to be the best spot when I only have the one cloth left. So if Mary is able to participate and help, I can get her over there by myself. If not, I may need 2 nurses. So Mary is going to be able to reach, and she's going to be able to, I'll try to prop her up here so that this all makes sense. Okay, so Mary's on her side, and I'm going to take a towel, okay, and I'm going to lay it behind Mary on the bed and kind of tuck it in underneath. So essentially I know you can't see that, but I'm protecting the bed. Okay, nice warm fresh soapy water again, come with a cloth, and at this point I'm assessing Mary's skin because I've seen the top of her pretty much, and I'm going to nice long strokes. I am washing her from top to bottom. So pressure points, scapula, scapular areas, coccyx, heels I already checked, but I'm giving her a bit of a good look right now. So this is still clean, and I am going to dry her off using the towel that I had placed to protect the bed. So I'll just, nice long strokes. I can say with 100% confidence that her skin is fine. No discolorations, moles, sores, scratches, rashes, there's nothing. I can see, I have full sense. Her scapular areas are fine. Her coccyx is not reddened. It's not broken. It's 100% fine. But her skin's dry. So while she's there, I'm going to take the opportunity to give her a back rub. Now, would I do this with an ambulatory patient? Probably not. You know, they can probably maybe have a shower, or I might wash their back. Would I massage them? May or may not. Depends on what their condition is. But bedridden people or people that are in beds, they need, you know, for extended periods of time, they need to have some mini massages and promote circulation. It's good for their skin. Okay, so that's 100% fine. While Mary is there, I am going to wash the anal area. So I may need to lift and separate so that I can see what's going on, so that I can visualize and see if there's any redness or soreness or any excoriated skin. So I can see, I've got it lifted, separated, I can see the rectal area, there's no redness, it's clean, it's dry, there's no sores. So I'm basically just going to clean that. Okay, obviously this cloth is not going anywhere else. So this, I'm just going to throw it right in the laundry because I am not using that anywhere else, nor am I going to put the dirty cloth back into my nice warm soapy fresh water. Okay, so that part's done. So Mary, I'm just going to get you to come back. I do have to wash the front, so I'm just going to, you'll feel the towel kind of maybe behind you a little bit, but just roll back. And I do have a towel in underneath here just to catch any wetness because I'm just going to get you washed in the front, but I'll keep you as covered as I can here for a second. So I'll get you back in the bed. So I've kept her as covered as I can. And now I'm down to here. Okay, so here's where I'm at. And I used my 3-face cloth. So now what? I mean, I can put the rails up, go get another one. But I do have a towel here. So I'm going to opt out to use my towel. Common sense. Okay. So I'm going to use this wet end of the towel, which is gathered up in my hand, and I am going to provide perineal care. So we're going to beat this perineal care on men and women a little bit in more detail when we get in lab. But essentially, women front to back, you need to open to see where you are and to see different sections. People that have excess skin and may have rolls, they need to be lifted. You need to see inside every roll. And for women, labia minora and labia majora, they need to be moved, separated, and cleaned in between. So, and you got to get right down. So you don't ever clean from back to front. It's always front to back. So that's why I kind of left the towel here when she turned back. So I'm just cleaning her in her groins. And if people are going to get sore excoriated skin, it's going to be right around here. So you just need to have a really good look at that. That part of the towel obviously is no good, but this part's fine. So I'm going to use this to dry. Okay, so there's lots of variations that you're going to see. And that is a legal move. That's a legitimate move. So this now obviously is dirty. So I'm just going to get rid of it. Put it there. And Mary, I'm going to pull that out from underneath you. And I don't need that any longer either. Okay, so at this point, Mary, I'm going to take this off you. And I'll put it here, cover you up, and cover you up. Now, we'll talk about changing an occupied bed, and we'll get into that. That's a whole different thing. And I'll get rid of that blanket. So at this point, now the only thing I haven't done is oral care, which is vital, and I do need to do it. But my gloves have been in some places that I don't want to go and do her oral care. So at this point, Mary is safe, she's warm, she's dry. I'm going to put the side rails up, I'm going to take off my gloves, and I'm going to get rid of the supplies that I don't need. So I'm going to get rid of the water and whatever it is that I don't need to provide oral care to Mary. So since Mary's teeth are actually dentures, I'm going to take these dentures over to the sink and put a towel down in the sink so that if they slip out of my hands, if I drop them, that they don't break. And I'm going to brush Mary's teeth, okay? I'm going to be very careful with dentures, but I'm going to brush her teeth. When I come back to Mary, I'm going to have on a new set of blue gloves, okay? And I am then going to, I might need to put Mary's head up. This bed's got an awful squeak to it, so I might put Mary's head of her bed up, and then with my blue gloves, have a look in Mary's mouth, because I want to check her gums, the roof of her mouth, her tongue. I want to look for sores, lesions, maybe she has thrush. I want to look for any difference in her mouth. There is an oral assessment sheet provided for you guys on Moodle. I want you to take a look at that. I also have the opportunity, this is, I don't know if you can see it, but it's like a sponge on a stick. Kind of looks like a sucker, but it's not. I could put this in a little bottle of mouthwash, and then I could provide oral care to freshen up Mary's mouth is an option. If she can sit straight up and she wants and has teeth and wants to get them brushed, I can sit her straight up and put a towel on, and I could brush her teeth and she could spit it out. So I tend to leave the mouth care to the last. Doesn't matter as long as it gets done. That essentially, I think, covers the basics of adult hygiene. The thing that I want you to really remember is that people don't necessarily, not everybody likes to be stripped off and bathed by another person. So please be kind, caring, and compassionate, and maintain as much dignity of the patient as you can. Just kind of put yourself there in their shoes and how would you want to be treated. And I mean, Mary, I'd want to comb her hair. If she had lipstick, I'd put the lipstick on. Men, we're going to shave, because if men shave, families don't like to come in and see their loved ones not look like themselves. So if it's a man, you're going to shave him. If it's a woman and she's got lipstick, put it on. So treat people with as much kindness and dignity and compassion as you possibly can. They really appreciate it. It's not all about the complex stuff that you do. Sometimes it's these little moments of where you're actually providing physical care that really mean the most to them. So with that being said, I apologize for the length. We will talk about some components and pieces and parts of this in lab, and good luck on your first bed bath.